Imagine you are at home alone with one of your loved ones when they have a medical emergency and go unresponsive. And you have no idea what to do because you've never been trained in life-saving techniques like CPR or cardiopulmonary resuscitation. Someday you may be faced with a situation where CPR is necessary to save a life. This is why I got certified my junior year of high school. Today I'm going to cover the steps before CPR, how to perform CPR, and why CPR is important in a situation where life is on the line. There are multiple steps that have to happen before CPR. All these steps came from the Red Cross website. First, you need to check if the scene is safe. This is especially important in a public area where it is uncontrolled. Now, in a hospital or medical facility situation, or your home, this is not as important. Next, check responsiveness of the victim. To do this, use the shout, tap, shout method, shouting their name if they don't respond, shaking them, and shouting their name again. Then you have to check their pulse on taking 2 fingers on their carotid artery and feeling for a pulse. If they don't have a pulse, you do not need to perform CPR, but still call 911. Now that you have established that your victim does not have a pulse, call 911 and get them to a hard, flat surface if they are not already there. According to St. John ambulances, you do not need to remove the clothes to perform CPR. However, if they need an AED applied, you need to remove all the clothes covering the chest area, as well as all wet clothing. And going along with this, removing them from any liquid, urine, blood, and other fluids. The American Heart Association states that men have a 23% higher chance of survival due to the comfortability of bystanders to help a man. So do not be afraid to remove any undergarments required. So to perform CPR, place your hands on the lower half of the sternum, like so, and start compressions at 100 to 120 BPM. And the compression should go down about 2 inches into the thoracic cavity. Now for an infant, use 2 fingers, and the compression should go in about 1.5 inches. Make sure to keep your arms straight and directly under your shoulders for the best results. Good posture will allow you to continue compressions for as long as possible. The Mayo Clinic says that mouth-to-mouth is no longer standard and can increase chances of transmission of disease. So if you are not trained properly and you do not have the proper equipment to do so, do not do mouth-to-mouth. Now that you know how to perform CPR, I bet you're wondering why it is so important and what happens when you perform CPR. So when the heart stops, blood also stops pumping through the body. This means that no oxygen can get to vital organs and they start to fail. Compressions keep the blood moving and allow oxygen to arrive at the organs that we need to survive, especially the brain. CPR is critical for survival in a situation where life and death is on the line, I guess. As we wrap up today, I just wanted to remind you of everything we talked about. We talked about the steps before CPR, how to perform CPR, and why it is so critical. Keep yourself educated, because one day CPR may be the only thing keeping your loved one from death. Thank you.